Hey there, Benchmarks members. This update is specific to FFPSA. The Department of Social Services has been heading up a work group. It's made up of providers, advocates in the community, department people, Medicaid, LME, MCOs. It's a whole collective of folks to work on implementing or work on a plan to implement FFPSA. They also have two subcommittees. One is to work on the prevention plan, and the other is around residential. And Benchmarks has representative agencies of Benchmarks that sit on all those, both the subcommittees and the full committee. And I participate in the full committee as well. We haven't seen a whole lot of movement. They hired Chapin Hall to facilitate the meetings, but there hasn't been a lot of concrete work that's come out of that. We understand that the next 6 months is when we'll really see some of that come to fruition. They hired Casey Family to do a fiscal analysis. That's been running separate. They've made that a bifurcated system. I believe they're going to try to integrate that at the next meeting. And our understanding is from the fiscal analysis that North Carolina will be at a deficit of drawing down federal dollars at this point with the implementation of FFPSA, which is not surprising. Most states are finding that. And we knew this bill wasn't cost neutral when it was passed. It's going to require state dollars, and it looks like for us it's probably going to be a pretty good amount. But hopefully we'll work with the state and all our partners, and whatever that amount is identified, we'll all work together to try to secure that funding through statute. So last week I was in Chicago with my counterparts from 21 different states. We spent most of the time talking about FFPSA. It was particularly concerning for some of the states there that were early adopters, and they are trying to navigate this transition, and some of them don't even have approved state plans yet for how they're going to implement this. So as you can imagine, they're a little panicky. But there were three key areas that I wanted to give you an update on that have been raised as an issue of concern. Not only have we raised it within my counterpart, that national group called NOSAC, not just within our NOSAC group have we been having this discussion, but we've also reached out to congressional members to express our concerns about them as well. So one has to do with the fingerprinting and the responsible individual list registry. It's called an RIL here. Most states don't call it that, but basically under FFPSA, you have to have RIL cleared for not just people who have direct contact with the children in a residential facility, but anyone who's connected to that campus. So folks who are working on the grounds or food or whatever it is, they're all going to have the fingerprint, and they have to have a clearance of the RL. If the person has worked in another state within, I believe it's a year or 6 months, I'll have to check it again, prior to coming to interview with you, you also have to check the RL for that state. Well, therein lies the problem. As you know, in North Carolina, we've struggled with RIL and the timeliness of that. And part of it has to do is we can't directly check the RIL list. It's in statute that doesn't allow us to do that. So we're dependent on the state to do it and then respond to us. I was able to get a list from New York. Their state had given them a survey of 39 states and how they do the equivalent of our RIL. And of the 39, 36 of them will not provide the information directly to a private provider, only to a state entity. And so we won't be able to reach out to that state directly. Our state will have to reach out to their state to make the request. And then their state will give our state the answer or the response to the RL. And then our state has to give that to us. Now, you can imagine how concerned we are considering the problems we have with the current system. And then there's also that none of these states have a system even set up to communicate this state to state. So we see this as a major issue going forward, and just even the volume of fingerprinting. So we want to make sure all of this gets worked out. We have requested that the department create a subcommittee with public and private providers, and we get together and try to figure out how do we navigate this effectively. Another issue that came up is IMD. If you remember, IMD is a Medicaid requirement that if you fit a certain criteria, basically that you do a treatment center, a Medicaid paid treatment, behavioral health treatment center, and it is for anyone that's 16 beds or more, it falls under IMD. And North Carolina got hit with IMD a number of years ago. A good number of our level 3s and 4s were shut down. So basically, to do a service, you have to stay under 16 beds. The QRTPs that are in this FFPSA bill require a treatment modality. And the way that it's written, these QRTPs fall under IMD. We've been raising concern about this with the congressional members that wrote this original statute, and they weren't that concerned until a whole lot of states started writing them. We actually sent information to them about the problem 2 years ago, before this bill even passed. We saw that it was going to be a problem then, and we were told at the time, well, it might be a problem, but if it is, when the bill passes, we'll take care of it. Well, the bill's passed, it still hasn't been taken care of. So we've been reaching out to congressional members to try to address it. The problem is that the QRTP requires a full-time nurse. It has a trauma model that has to be in place. You have to provide treatment. Well, all of that, as I mentioned before, makes this an IMD. It makes it fall under IMD. But to have those types of services that are required under the QRTP is very, very expensive, and it requires an economy of scale. So being able to do this with 16 beds or less is really going to be difficult. And so there has been a request that an exception be made to the IMD for these QRTP facilities. And our current psychiatric residential treatment facilities in North Carolina, PRTFs, they are an exemption. The whole country has an IMD exemption for PRTFs. We're asking that the same be provided for the QRTPs. Now, I don't know that that's going to happen. I can tell you there's a lot of us asking for this, but there is a tremendous amount of reluctance, and the reason is cost. If they remove the IMD restriction, it means that states will have more of these beds because they kind of have to for the economy of scale, but they want to restrict the number of beds because any of these types of residential treatment beds are expensive. And so the IMD puts some controls in that. We'll keep you informed as we move forward. We actually had a conference call with a number of staffers last week, and Benchmarks has been talking individually with our North Carolina congressional members. So the last thing is there is a bill. It's called the Family First Transition Act. I'll get this right. And this bill has been created by actually some of the bill sponsors of FFPSA. And it does a few things that we think are pretty fabulous. One is it provides $500 million to states that they can draw down to help with the planning and implementation of FFPSA, which is wonderful. The other thing it does is it delays the 50% requirement for well-supported for the prevention services. And this is important for a couple of reasons. One is there's not a lot of the well-supported on the current federal registry list that states can use. And we need to add more, but they have to get them approved first. So this takes some time. And because there's so few, that means that there's a lot of states that are approaching those very few evidence-based practice founders, providers, trainers, and the capacity to ramp those up across your state is very, very difficult. So as a result of that, this allows for more time. It's a 2-year transition that allows you to hold off. It's actually an incremental implementation of the 50% requirement. This act also has some language around states that are 4E waivers. We are not a 4E waiver, so that doesn't affect us, but the language in there is actually really good for the states that are a 4E waiver, so that's important for them. There was some other language that was in there that we had been pressing to include, but most of that was, a lot of it was stripped out. So this is what's remaining. There was some really good language that we had hoped would be included, but can't get everything. So anyway, this bill is hopefully going to pass by the end of this year. There's some discussion about what the vehicle will be that Congress will use to move this. It's been kept kind of hush-hush, which is probably good because that gives them a little more opportunity to find a vehicle that people haven't preempted to stop if they are not in support of the bill. But hopefully we'll see this passed by the end of the year. So we're going to keep giving regular updates on the FFPSA because, as I mentioned, we should see a lot more work getting lifted as far as plans in the next 6 months, and we want to make sure everybody's on board and aware of what's happening. We also have attached to this video 3 documents. One is the summary of the Family First Transition Act. This summary came from the bill sponsors of the bill, so this is the most accurate we can get you. The other is there's a document there from CMS, and it was in response to the issues around IMD, and it was a frequently asked question. Basically, it was a document explaining what a IMD is, which we already understand that part. And instead of it being helpful in providing an exclusion for QRTPs, it actually said your state can create the service, and if they create the QRTP and it's a service that meets the requirements of IMD, then you are under IMD. And if you create a service that's 15 beds or less that's not an IMD, that's not an IMD. So as you can see, it didn't really do anything at all to help us. But I wanted you to see it because that came out from CMS in response to this. And I also included the document we received from New York that has the process for the responsible individual list for the 39 states that have been identified. So hopefully some of that will be of help to you. Anyway, we hope you all have a wonderful week. And as always, please feel free to give us a call if you have any questions at all. Thanks.